Well, good morning. My name is Merrill Thomas. I'm the president and CEO of the Providence Community Health Center. We're here this morning to talk about the importance of flu shots, and I know there's a lot of COVID fatigue and people talking about tired of all the things going on in COVID, but today it's really important to remember that part of good primary preventive care is really getting your annual flu shot. So I'm going to turn it over to the professionals on this. I'd like to introduce the medical director for the Providence Community Health Centers, Dr. Andrew Saul. Andy?
Thank you. Good morning. My name is Andrew Saul. I'm a family physician and honored to serve as the Chief Medical Officer of the Providence Community Health Centers. I have the best job in the world. I get to serve this most extraordinary healthcare team. COVID continues to smolder in our communities, but it's not the only troublemaker in town. For as bad as it's been, coronavirus is only a runner-up in human history for causing sickness and unnecessary deaths. The grand champion, of course, is the common flu. And influenza is not sexy, it isn't glamorous, and it doesn't often steal the headlines, but it is an equal opportunity troublemaker. Flu doesn't care about your race or your ethnicity. It doesn't care who you are or what you do for a living. It is, however, more than glad to take care of your vaccine status. In a good year, influenza only kills 30,000 Americans. That's only a few hundred Rhode Islanders, including children and healthy young adults. But have hope. We can do something. It's fast, it's easy, and it's free for most Rhode Islanders. What's our secret weapon? Roll up your sleeve and get a flu shot every fall. Yes, you may have a sore arm for a day, but a sore arm for a day is better than being down with the flu and unable to work for a week. Or worse yet, being home with a sick toddler sent home from daycare for a week. Or worse yet, not being able to take care of your kids because you're not there. So influenza is not sexy or glamorous, but it is sneaky. Most of us might only have a runny nose or a few mild symptoms. We power through and go to work to care for our families, completely unaware that we are one of the most efficient spreaders of influenza. Yes, we, the caregivers, end up spreading flu through our homes, our neighborhoods, our workplaces, and to some of the most fragile members of our community. We like to pretend we're young and healthy, but influenza doesn't care. It loves to take advantage of people with diabetes, heart disease, asthma, and flu is more than glad to hitch a ride in your body to get to someone more vulnerable than you. So yes, you may have a sore arm for a day, but by getting a flu shot, you are helping to interrupt the transmission of a very sneaky, ever-evolving killer of those we love. So don't miss your opportunity. Take a few minutes today to find out where you can get your flu shot, whether it's at your church, your town hall, your corner pharmacy, or your neighborhood health center. Don't miss your opportunity. Every October, every year. So get vaccinated and help stop the spread of flu in our community. Roll up your sleeve for your mom, your grandfather, your kids, and your neighbors. Help make Rhode Island a better and healthier place to call home for all of us. Vacunate, get vaccinated. Thank you. And can I introduce our next guest? Absolutely, Dr. Phil Chan, Rhode Island Department of Health, and many, many other hats. Welcome aboard.
Good morning, everyone. Thank you all for being here. And of course, I have to thank Merrill Thomas, Dr. Saul, and really the whole team here at the Providence Community Health Center. These are really some of the under-recognized and unsung heroes, not just of the pandemic in general, but really of healthcare in general. So thank you all for all that you do here. We have to really acknowledge your hard work. Each year we talk about how important it is to get the flu vaccine for everyone older than 6 months of age. And this year, that is especially true. For the past 2 flu seasons, we've actually seen really low levels of flu. And that's great. It's because we've been masking, we've been social distancing. Everything that we know that works against the COVID also works against the flu. So we've seen historically low rates for the last couple of years. As things get back to normal, though, experts are predicting a much more severe flu season this year. And that's because, of course, we're not taking the same precautions in general out in the community. There's some good news, though. As Dr. Saul mentioned, the flu shot works. It helps protect you from serious illness and hospitalizations and deaths, similar to COVID vaccination. And sadly, serious illness, hospitalizations, deaths do occur with the flu, similar to COVID-19. It can be very serious. And I was reminded last week, I had a patient who walked in otherwise healthy in his 40s who developed cough, fever, respiratory complaints, and of course, he thought he had COVID. And he said he was knocked on his butt and at home for a week. Turned out he had the flu. And that's a familiar story that many of us here in healthcare, flu can be serious. It can definitely keep you out for a week. And in especially older populations, as Dr. Saul mentioned, and people that are immunocompromised, it can cause very serious disease. During the 2018-19 flu season, so right before the pandemic, the flu resulted in over 1,000 hospitalizations here in Rhode Island and 39 flu-associated deaths. And as we all know, our healthcare system is overwhelmed at the moment, our hospitals, so everything that we can do to decrease the burden on our hospitals and our healthcare system is really important. And even for people that don't end up in the hospital, as I mentioned, people can spend up to a week in bed and really be out, whether it be out from work, kids out from school for a week. As a parent myself, right, it's very difficult when your kids are out for a week, to manage work yourself, etc. The people that are especially important to get a flu vaccine include those that are older than 50, healthcare workers, anyone who lives in a long-term care facility, like a nursing home, like an assisted living, children younger than age of 5, people who are pregnant, and people with weakened immune systems. Places to be vaccinated include healthcare centers like PCHC, primary care providers, pharmacies, and school-based clinics as well. I'll highlight evening-based school-based clinics are being held throughout the state of Rhode Island. These are open to families, not just students. They're free for uninsured, so people should check those out. You can see a schedule on our Department of Health websites. We at the Department of Health are definitely dedicated to equity and access for flu and COVID and everything in between. In addition to flu and talking about COVID, it's also important to get your COVID vaccination shots. So reminding everyone that anyone 5 years of age and older who has received at least a primary series of COVID should get their bivalent COVID booster at least 2 months after their last dose. A common question we're getting is, can you get your flu shot and COVID booster at the same time? The answer is yes, please do get them both at the same time. It's convenient and easy. Another common question we get is, can you get flu from the flu vaccine? And the answer is no, 100% no. After you get the flu shot, similar to the COVID vaccine, people can experience slight ache at the injection site, maybe a little bit of general malaise, headache, maybe mild chills, and that's normal. It means your body is developing the antibodies against the flu, and that is a normal effect of getting the flu shot. And these symptoms are generally much less significant than the actual flu. Again, you cannot get the flu from the flu shot. The other common question we get is, do I need a flu shot every year? And the answer to that is yes as well. We know a lot more about viruses and variants due to COVID, and we use variant a lot when we talk about COVID, but the same concept is similar to influenza, the flu virus, meaning that virus mutates from year to year, which is why people need an annual flu vaccine. So yes, you need a flu shot every year. I got one. I got mine on Friday. My wife got one. My kids are getting one at one of the school-based clinics actually this week as well, and I'm asking you all to get one as well. I'll wrap up by saying we have a lot of information online about the flu, list of clinics. Please check us out on our website, health.ri.gov/flu. And with that, we'll open it up for questions. Thank you all.
Any questions?
Please.
So if you get the flu shot and the COVID shot simultaneously, what can we expect in terms of side effects? Will it be doubled, or would it be pretty mild, or what are we thinking?
Yeah, what we're generally recommending is for people to get one shot in each arm, similar to either shot alone, really the same thing. So a little bit of perhaps general malaise, not feeling a little bit down, maybe a little bit of a headache. People should generally not develop respiratory symptoms. People may have sore arms, that's kind of the biggest thing, but we don't expect anything above and beyond getting one shot by itself.
Is there one that you would recommend prioritizing over the other if people are feeling vaccine fatigue at this point? Are you worried about that or concerned at all? What would you recommend to those people?
So I'll speak on myself personally. I got the COVID bivalent first. We are seeing slight upticks in the community. I do think that COVID in general is more serious than the flu, but not always, and it depends on you, the person. But I got my COVID shot first a couple weeks ago, and then a week later I got my flu shot.
And are you worried at all? I know the national CDC has sort of been worried about what they're calling like a twindemic of both of them sort of upticking as people start to take their masks off as we relax those restrictions a little bit.
We're very concerned, and it's not just a twindemic, it's also other respiratory viruses like RSV. Some of you may be familiar. There's multiple respiratory viruses, And it's overwhelming our healthcare system. And I was just talking about with Meryl and Dr. Saul in the hospitals this past week. Our healthcare system is stretched to the limit. So anything we can do to reduce the number of healthcare visits, both to community health clinics as well as to hospitals, is really needed. So please, get your shots.
Could you also just explain how every year you sort of monitor what the flu is doing sort of in other parts of the world and how you're sort of able to predict what it might look like for the U.S. each year?
Yeah, it's a good question. So the flu is, as we know, goes up and down, and it goes up and down in various parts of the world. So what we see in the southern hemisphere often precedes what happens here in the United States. And so often we're able to predict what may happen, and there's very strong correlation about what happens in other countries just before what happens here. And what we've seen in other parts of the world is that the flu has been pretty severe. And that's why we have an unfortunate suspicion that it's going to be pretty severe here in Rhode Island in the United States as well, which is why we're really pushing flu shots this year.
For people who do test positive for COVID, how soon after they are testing positive should they get their flu shot?
So for people that test positive for COVID, I'd recommend complete resolution of symptoms. Generally, that's going to be a week or two. I'd wait at least that long. If people have questions, though, they should always check in with their primary care provider as well. It can be different for each person. For people that are asymptomatic with COVID who are diagnosed, I'd probably wait at least a week, 7 to 10 days.
Do you foresee, COVID vaccine, flu vaccine sort of becoming our fall trend and sort of our new vaccine, list to check off in the future?
Well, I hope not, actually. There's a lot of research happening on this. So one thing for the flu vaccine is that there's a lot of companies working on a single-dose flu vaccine, one time only and then done. And that would be very exciting, obviously. For COVID, I think, as we all know, the unexpected has really been the expected. It's difficult to predict. At this point, I would recommend people get the new bivalent booster. I am optimistic, though, that we won't need one every year. And if you look at what's happening with COVID at the moment, we're seeing the current strains are actually subvariants of Omicron. So the summer earlier this year, it was all about Omicron, BA4, BA5. The ones that are coming out now are subvariants of Omicron. That suggests to me, hopefully, that the COVID virus is mutating less within that family. So hopefully these new Omicron-specific bivalent COVID boosters will protect against COVID in the long term.
And for the people that get the flu vaccine and say, oh, well, I always get the flu after, or they gave it to me, I know you said I can't give it to you, but what would you tell them?
I suspect that a lot of people who think they have the flu may not have had it. The flu can really, again, knock you on your butt. And again, there's dozens of respiratory viruses out there. So what we generally see is when people get like a stuffy nose or feel a little bit crummy, that's generally not influenza. That's generally something else, like maybe enterovirus or rhinovirus, et cetera. Of course, similar to COVID, these viruses, whether it be influenza or RSV or otherwise, they affect people across a spectrum of illness. So some people do have very mild symptoms, and some people have very severe symptoms. But influenza, before COVID, influenza was one of those viruses that we tended to think as pretty serious. And again, as Dr. Shaw mentioned, it does cause a significant number of deaths and hospitalizations every year. Okay, thank you very much.
We have now the